The search for effective ways to slow down or even reverse biological aging in multiple sclerosis, MS, patients has led researchers to explore dietary interventions, particularly calorie-restricted and ketogenic diets. A recent study suggests that these approaches may significantly reduce biological age in individuals with relapsing remitting MS. While this finding may appear promising on the surface, a deeper analysis raises serious concerns about the practicality, sustainability, and potential risks of these dietary interventions. The complexity of MS as a disease means that while metabolic changes may temporarily improve certain biomarkers, they do not necessarily translate into long-term health benefits or disease remission. In fact, dietary manipulation may introduce unforeseen consequences, particularly in a population already burdened with significant health challenges. The study, conducted at Johns Hopkins University, JHU, and the University of Virginia, UVA, found that patients following a calorie-restricted diet experienced an average reduction in metabolomic age of 6.58 years, while those adhering to a ketogenic diet saw a decline in biological age at a rate of 1.06 years per month. These figures suggest that fasting mimicking and ketogenic diets may help slow down the accelerated aging commonly observed in MS patients. However, biological age is a complex metric influenced by numerous factors, and improvements in specific biomarkers do not necessarily correlate with tangible clinical benefits. Without concrete evidence linking these dietary interventions to improved disease outcomes, such as reduced relapses, decreased lesion activity, or enhanced neurological function, there's a real risk that enthusiasm for these diets could lead to unrealistic expectations or even harmful consequences. One of the major concerns surrounding calorie-restricted and ketogenic diets in MS patients is their long-term feasibility. Both diets require strict adherence to specific nutritional guidelines, which can be difficult to maintain. Calorie restriction often leads to increased hunger, fatigue, and potential nutrient deficiencies, while ketogenic diets demand a dramatic reduction in carbohydrate intake, which can cause gastrointestinal distress, electrolyte imbalances, and adverse metabolic effects. Moreover, these dietary interventions may not be suitable for all MS patients, particularly those who already experience issues with weight loss, muscle wasting, or difficulty in maintaining adequate nutrition due to swallowing problems or fatigue. Encouraging such patients to adopt restrictive diets without fully understanding the long-term implications could do more harm than good. Furthermore, the impact of dietary interventions on MS progression remains largely unproven. The study focused on biological age, measured through metabolomic markers, rather than traditional MS disease markers, such as lesion activity or disability progression. While changes in metabolomic age might indicate shifts in cellular metabolism, they do not provide clear evidence that these dietary approaches slow disease progression, reduce disability, or improve quality of life. Without direct clinical benefits, advocating for restrictive diets as a form of MS management could mislead patients into believing they have found a cure or an effective alternative to conventional treatments. This could lead some to deprioritize established therapies, such as disease-modifying treatments, DMTs, which are backed by extensive clinical evidence. Another critical issue is the potential for unintended health risks associated with extreme dietary changes. The ketogenic diet, for example, has been linked to increased cardiovascular risks, including elevated cholesterol levels, which could be particularly concerning for MS patients who are already at higher risk of heart disease. Additionally, prolonged calorie restriction can lead to weakened immune function, which is particularly problematic for MS patients who rely on a well-regulated immune system to avoid disease flare-ups. Given that MS is an autoimmune disorder, the long-term impact of dietary interventions on immune function remains uncertain. There's a possibility that extreme dietary changes could inadvertently trigger immune dysregulation, potentially worsening the disease instead of improving it. The study also raises ethical concerns regarding the promotion of dietary interventions in a patient population that is often desperate for new treatment options. While dietary changes may provide supplementary benefits, They should not be presented as a primary therapeutic strategy unless substantial clinical evidence supports their effectiveness. Encouraging patients to embrace restrictive diets without fully understanding their risks and limitations could lead to frustration, disappointment, and potential health complications. Patients who struggle to maintain these diets may feel as though they are failing in their disease management, adding unnecessary to psychological stress to an already challenging condition. Another troubling aspect is the potential commercialization of these findings. The growing popularity of ketogenic and fasting-mimicking diets has led to an industry of supplements, meal plans, and expensive programs that claim to offer life-changing benefits. If these diets gain traction within the MS community without proper scientific validation, patients may be vulnerable to exploitation by companies looking to profit from their condition. It is essential to separate scientific inquiry from commercial interests and ensure that MS patients receive accurate, unbiased information about their treatment options. The reality is that MS remains a complex, multifaceted disease that cannot be effectively managed through diet alone. While lifestyle factors, including nutrition, play a role in overall health and well-being, they should complement, not replace, evidence-based medical treatments. Patients should be cautious about embracing extreme dietary changes without consulting their healthcare providers and considering the potential risks. Until larger, long-term studies demonstrate that calorie-restricted and ketogenic diets offer clear, measurable benefits in terms of disease progression, disability reduction, and overall quality of life, they should not be widely promoted as viable treatment options for MS. The findings of this study should serve as a cautionary reminder that excitement over potential breakthroughs must be tempered with rigorous scientific scrutiny. The promise of a reduced biological age may sound appealing, but without clear clinical benefits, it remains a theoretical advantage rather than a practical solution. The danger lies in presenting unproven dietary interventions as game changers when, in reality, they may do little to alter the course of the disease. Until more robust evidence emerges, MS patients should focus on proven treatments while maintaining a balanced, sustainable diet that supports their overall health without unnecessary restrictions. The last thing this vulnerable patient population needs is another false hope that ultimately leads to disappointment and potential harm.